Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And I'm thrilled today to welcome our public health nurse, one of our public health nurses, Flavia Martin. Welcome, Flavia.
Thank you so much for having me here. I'm really excited to be here. I love coming and speaking with you.
It's been a while.
It's been a while, but it's always fun.
We've spared you some television time, but it's been a while. A lot has happened since you were last on. So just if you could review for everyone what your role is at public health, because you have a very specific role as far as public health nursing goes. So just let us all know what that is.
Sure. So we have my role in the community health department. I am the Communicable Disease Nurse Program Coordinator. So we have many communicable diseases in New Hampshire, which are reportable. And we essentially follow up on those reportable diseases. We want to find out where people may have gotten it, how we can protect those that could affect, protect people that were exposed, and make those types of education, recommendation, and also provide infection control recommendation for the healthcare systems and for private individuals.
Okay, so when we say reportable, I know the answer, but who are you reporting these to? And why?
Sure. So in New Hampshire, we have 63 diseases which are mandated reportable. They're reportable from the laboratories that are running these tests or the provider offices. And they get reported directly to the state of New Hampshire, to Concord. And if somebody's a NASHUA resident, it gets sent to our office for follow-up. So these are part of our state, RSA, the laws, which mandate reporting certain communicable diseases that are a threat to the public.
And so one thing that was in the news recently was salmonella. Now, that is reportable to the state, but it's different because it's not a communicable disease. So is that?
Believe it or not, it is. It is a communicable disease.
Oh, okay.
Yeah.
Well, I guess it is because it's the muck gets on something and it
right.
spreads.
Yep. A lot of salmonella, like a lot of illnesses that affect the GI system that causes the nausea, vomiting, diarrhea type of diseases. They follow typically like a seasonal pattern. You see a lot more cases in the spring, summer, fall. Especially when you're having a lot of cookouts outside, there's always a risk for a foodborne type of salmonella. Salmonella is almost always a foodborne disease, but many years there's outbreaks nationally, where somebody can get exposed to salmonella from, ground beef. There could be, the lettuce from, that's grown in an individual place and then gets sent across the country.
And you see that with E. coli as well, right?
We do, yeah. E. coli and Cryptosporidium and a few other different bacteria or pathogens that cause the GI, what we call those symptoms, the nausea, vomiting, diarrhea type of thing.
All those fun things.
Yep, so we have seen an increase in salmonella cases. 'Tis the season for it, and we usually recommend food safety for people, keeping foods at the right temperature, cooking things appropriately, cooling things down to discourage bacteria growth, and washing, cleaning, and trying to prevent disease from spreading.
A lot of familiar themes there, keeping things clean and keeping things from spreading, and how do we do that? So we're gonna back up and just do a little COVID update, since that also is a communicable disease. And you were very, very busy, obviously, the last few years tracking many, many cases. And I was fortunate to be on your team tracking many, many cases and talking to people. And
it was a team effort.
It definitely was a team effort because we got a little overwhelmed at certain points.
We did.
A little. Okay, a lot. But right now, COVID community levels, and that's what we're using to look at kind of our risk of transmission and things like that, are fairly low. So we have a map, and in New Hampshire, specifically the NASHUA area, all the way up to about Coos County, we're green. So that's exciting. If we look at the United States map, we do see things heating up a little bit in Florida, California, a little bit out in the west. Things are getting more yellow, so that's just kind of be cautious. A lot of these transmission levels are based on hospitalizations and how the hospitals are functioning, whether or not they're getting overwhelmed or not with COVID cases.
Right.
So that's kind of where we've settled. We've been fortunate here in Nashua so far.
Yeah, we really have. We were in the red just, some weeks ago. We saw that little spike when Omicron, the B2 variant came up. We saw that spike, and we have been in a downward trend for about 6 weeks or so now, and we're back down to green, which is a good place to be at in terms of community transmission.
Yeah, and we're also fortunate that the weather's getting better, or it already is better, and that we can be outside a little bit more.
Yes.
Still think about those gatherings. Indoor gatherings, yes, you can have them, but it's still better to be outside.
Yep.
Or to have the windows open if
Yep.
you're going to be inside. Make sure you have good air circulation.
Yeah, thinking about the ventilation system and fresh air and bringing that into, even if you're going to be in an indoor environment, that would be great. And if somebody is considering themselves high risk, then, an individual person can choose to protect themselves by taking extra measures, by wearing a mask, by, those different mitigation features, and getting tested. Any symptoms, somebody should get tested because you never know. You don't know if it's allergies, you don't know if it's COVID, if it's a new symptom, we always recommend to get tested.
Right, any little thing. And, a lot of people do say that, especially this time of year. Oh, I have allergies, I have the allergy cough, I have those kind of things going on, I'm sure I'm fine. No, now we're at the point where you absolutely have to get tested.
Yes, especially if you're going to, to a celebration. There's graduations everywhere and parties and baby showers. If you're going to be gathering with people and you do have some symptoms, I think it's better to get tested. We have the availability of the over-the-counter tests, which are quick and easy, and just do that quick swab, and then you know for sure.
And you can still order them. So the federal government is still shipping them out via the post office, which I was really glad about because I was running low on tests. I myself tested positive several weeks ago. I think it's been a month. I don't even know. Time flies when you're having fun. But I did the rapid test at home, and it came out positive, so it was good because I could protect my family. I could go into a spare bedroom and stay away from everyone. It wasn't exciting, but I was able to stay away from everyone, and no one else in the household got it as a result of that. So that was really a positive thing. No pun intended.
Yeah.
So if we look at the state levels, again, we see Hillsborough County, we see our region really doing quite well. We're green. Just our friends up north are still struggling a little bit. They're yellow, they're medium risk. So just really want to encourage them to pay attention to what's going on there. If you have relatives up there, if you're traveling up there. And then, again, we always say it's not too late to vaccinate. So
Absolutely.
It's still our best form of protection against COVID-19.
It really is. If somebody has been 5 months since they got their last dose, boosting would be really important to keep that immunity up. And recently it was recommended for kids 5 and up to receive that booster. We were vaccinating kids back in November,
right,
December, so they are, a lot of those kiddos are coming past that 5-6 months now, and they should really get that booster to just keep up their immunity and help protect them.
Absolutely. So we know that even with the vaccine, you're not 100% protected, but in my case, I did have my full series and a booster. I had a very mild case. I'm very grateful that I had, a couple days of discomfort and chills, but really I recovered pretty quickly. I was not hospitalized. It was not severe. That's really, really important because we also know from early on in the pandemic, when you were exposed to COVID, people got really, really sick.
Yep. So the more people we can keep out of the hospital, mild symptoms, the better it is overall for their own personal health and for our healthcare system as a whole.
Right. So we want to protect ourselves, we want to protect others, we want to take care of our community and the health system. And I think that's all I have on COVID, which is shocking. Oh no, I have more.
Okay.
So there's always more. It's been an interesting year, and we're learning all the time. And I think that's one thing I just I was really fortunate to go to a public health conference, and we talked about, obviously, you can't, it's the elephant in the room, you can't not talk about COVID, having just been through this last really 2 years of the pandemic, and realizing that we're learning all the time. New therapeutics are coming out, we're understanding how this works, and really exciting. Vaccinations for young children, 6 months to 5 years old. We do want people with those 6 months to 5 years of age to call your pediatrician or your family practice doctor to arrange for that vaccine.
We do. It's really important for children that age to have that connection with a primary care provider, so they're getting their yearly physicals, they're getting all their childhood immunizations, whether it's for hepatitis B or for, measles, mumps, rubella, their normal pertussis types of vaccines. It's important for those kids to have those yearly follow-up, and including that discussion with their primary care provider about the COVID vaccine coming up from the 6-month-old to the 4 or 5 year age group.
Yeah, so there are a few different limitations. There's a lot. There is some. There's obviously people know about Pfizer and Moderna, and they have different. I believe Pfizer does go to the 4-year-old, and the Moderna goes to 5. So it just is a big variety out there. So that's why we ask people to see their pediatrician. And I know for a fact, because we've been talking about this youngest age group for quite a while, that in this area, the pediatricians are preparing for how they're going to handle that, whether that your pediatrician is affiliated through one of the hospitals or through Dartmouth or whatever system they're in. They have been preparing, and they have been thinking about how they are going to accomplish this. So again, reach out to your provider. And even if children have had COVID, they should still think about getting the vaccine.
They should, yep, because it's going to keep circulating over and over again. A lot of young children are in a child care center or schools, and it's really important to keep them healthy year-round and keep it out of the classrooms and out of those environments where they're with other people in the community.
Yeah, and we did have a high percentage of children in this age group that were hospitalized because they were the group that were not able to be vaccinated. So stay tuned, read the news, and then call your provider.
Yes.
If you have a child in this age group. So I promised myself that we wouldn't just talk about COVID, because there are a lot of communicable diseases out there, and you can attest to that.
There are.
So, you had let me know a few weeks back you had gone to a tuberculosis conference. So let's talk about tuberculosis in NASHUA, and, let's a little bit about it in our community and the history of it. I did do a little research. So it was discovered in 1882. So I thought, we were mostly past this, but then I hear what you're doing, and I'm like, oh no, we need to tell people about this. Back then, 1 out of every 7 people in the United States died from tuberculosis. So that is huge. We have come a long, long way, and a lot of that's due to vaccination.
Prevention efforts.
And prevention.
Yep.
Tuberculosis is highly contagious.
It is.
And one thing they did, and we have a picture they can pop up, back in the late 1800s, early 1900s, had isolation. It sounds very familiar. And we had sanatoriums. So we have a little picture of one that was actually up in New Hampshire. You can see the big porch. People are on their beds looking out over those mountains, but they were whisked away to keep away from their families and to recover. And then in the 1980s, we had a resurgence. Some of that was related, I believe, to HIV. If you can explain that probably better than I can.
Yep.
I might be putting you on the spot.
No, it's that decreased immune system, that allows these other bacteria and pathogens the opportunity to kind of take hold and grow and cause somebody to become very, very sick. Yeah.
So we did see this resurgence in the 80s, and now we'll fast forward to now, and we do have tuberculosis cases that you monitor. So just tell us some of your work in the city and how that works.
Sure, yep. Tuberculosis is still, a leading infectious disease. I think it's the second leading infectious disease case, disease burden in the world.
Oh, wow.
So we are fortunate in the U.S. the cases are much lower than in some other parts of the world. New Hampshire is considered a low burden state. We usually see about 15 cases per year. Here in Nashua, we see about 4 to 5 cases per year. So not too many, but when we do have a case, it is infectious to other people, and we want to try to protect the community as a whole. Tuberculosis is a program that we have, and when somebody is diagnosed with tuberculosis, we do a contact investigation because we want to protect those that were exposed. If they are, we want to treat if they have what's called latent tuberculosis infection, and prevent them from developing disease. So it's a big a big program that we have in order to protect the community. I did attend that tuberculosis conference out in California, and it was fantastic. The past 2 years, or close to 3 years, we've been focused so much on COVID that it's predicted that we're going to see a spike in tuberculosis cases.
Which is unfortunate.
Yes, because of the delay in starting treatment, delay in identifying tuberculosis, and delay in seeking care too. The combination of these three can, kind of put it out there in order to create more transmission, more people that don't know they're infected with tuberculosis bacteria, which will become active disease sometime in the future, causing a little spike before we can tackle it.
I'm sorry, I was just, how do you test for it?
So the CDC started this new campaign this year. It's called Think, Test, Treat TB. So we want people to be aware of it, think TB. Test for TB if you're at high risk. So tuberculosis, there are 2 types of tests. One is a skin test, put a little, what's called a tuberculin skin solution. It's a protein solution, little bubble in the arm. A lot of people have done this, in schools or provider offices, pre-employment type of test. It's a little bubble in the arm. It goes away, and then 2 days later, you look at it to see what the reaction is. And, more of a newer test, it's a blood test. To test for tuberculosis in the blood, to look for antibodies in the blood. And then if somebody does have a positive result, it does not mean that they have active tuberculosis. They're not necessarily infectious to others. But if they are found to have tuberculosis bacteria in their body or evidence of it, you want to treat them while it's still latent or dormant, to kill that bacteria, and then later on in life, it doesn't have the opportunity to grow and become active and spread to others.
So if it's dormant, are you still considered contagious?
No.
Okay.
Nope. So tuberculosis is very slow growing. It can take years for it to, develop into active infection. Somebody can be exposed as a child. They can be exposed, to a grandparent, uncle, whoever, when they were young, and then that bacteria, you breathe it into your lungs, or it finds a warm, fuzzy spot somewhere to grow, and it gets encapsulated.
The warm, fuzzy spot doesn't quite go with the description, Flavia, but that's okay.
Yep, and it just kind of becomes encapsulated right there. It finds a corner somewhere, and it just stays there.
Hangs out in your lungs.
Yeah, it can stay. Tuberculosis, there's pulmonary, which is in your lungs, and there's extrapulmonary. You can get tuberculosis anywhere in your body.
Oh, I didn't know that.
Yes, you can get it in your brain, you can get it on your knee, you can get it in your gut, you can get it anywhere in your body, because it can travel through your lymphatic system, travel through your blood system. So it finds somewhere warm and cozy, stays encapsulated for many, many years until something triggers it to come out. So it could be a decreased immune response, somebody who's older and decreased immune system. Somebody may have, are taking an immunosuppressive medication because of an organ transplant or chemotherapy, or HIV infection too. If somebody, has, again, that decreased immune system, that has the opportunity to just become active. And then at that point, it could be infectious if it's in your lung. Wow. So if we catch people early and we treat it, which is just a much quicker treatment, and they kills the bacteria, and then they don't go on to develop disease.
Right. So it's a long course of treatment, isn't it?
For active tuberculosis, yes. It's usually daily medication for at least 6 months. And depending where it is, the location of it, it can be 12 months, it can be 9 months of, daily heavy-duty antibiotic medications to take.
And you guys are pretty serious about this because you make sure people take their medicine.
We do. In New Hampshire, it's required that somebody, and many other, in all states across the U.S., these medications, they have to be done by daily observed therapy, where we have staff that watches somebody taking their medication, making sure they're taking the, the correct dosage, the correct pills every day in order to effectively kill the bacteria and somebody doesn't develop resistance. So the bacteria doesn't, mutate, develop resistance, because then that would be really bad.
Definitely. So some signs and symptoms of tuberculosis: coughing. These are really general for 3 or more weeks, but coughing up blood and mucus, chest pain or pain with breathing or coughing, unintentional weight loss. I've heard that as a telltale sign. Fatigue, fever.
Fever, chills, night sweats.
Night sweats.
Yeah, and the cough. And how I mentioned to you about delay in treatment, delay in recognition. So many times we see people develop, with that, 3+ weeks of cough, fever, chills. They go to their provider, right? They're getting, medically assessed. They're getting that chest X-ray. They get diagnosed with pneumonia. So then they're given a Z-Pak or some other, ammonia medication to treat pneumonia. They feel a little bit better, and then, it's tuberculosis. It's not the appropriate medication, and they get sick again. They go back, and it's like, oh, you still have that pneumonia. So, there's that real delay. Because, again, New Hampshire, we're fortunate to be low burden, not have a lot of cases. It's not necessarily the first thing that providers think of. So when 3 months down the line, when somebody is actually diagnosed with tuberculosis, there's been that, big, long, term there where they are infectious to other people.
Oh, yeah.
And, they're getting progressively worse before getting diagnosed and started on the correct medication.
Yeah.
We see that so many times.
Yeah,
And, and that's why every March, it's World TB Awareness Day, and we're like, think TB, and not just March, but,
think about it all the time.
Yes, we think about it all the time, but we want, all providers to be thinking about it too.
Well, because you often do think of it like, oh, it's an old disease, it's not going to get me, or what, so I think it is something that, we have to create that awareness that it's still around.
Yes.
And to your point, that people were not seeking medical care for a couple years. Regularly, unless they got really, really sick. So there may be an increase.
Yeah.
So we're going to switch gears to the latest disease du jour, which is monkeypox. We've been reading about it in the news. I do have a picture of what some of those lesions look like. A little bit scary, but we know that we have 72 cases right now in the United States.
It's 100 as of this morning.
Oh. Thank you for correcting me.
No, every day we're going to get a new number.
Right. And what do we know? What do we know? Like, in a nutshell, how's it spread?
I think the biggest takeaway that I want people to know is that it's not as contagious as, say, COVID. It is spread mostly through close personal contact. You can get it from someone by being, less than 6 feet away, but we're talking about over 3 hours. That's not the primary mode of transmission. It's not so much respiratory like COVID. It's more of a close, personal, intimate contact is what we're seeing. Or oftentimes healthcare provider by like handling the linen and having, that more close type of, taking care of their wounds and whatnot. So it's not something so easily transmissible like COVID, but it is something that, we want people to have an awareness of it in case they were in contact with someone with, the telltale rash and all that, to seek health care and let their provider know of, their exposure.
Sure. So that's just very important because, again, we're early on in this, so hopefully we can catch it quickly.
Yep. You're not going to get it at the grocery store. You're probably not going to get it at the movie theater. You're not going to get it, by your activities of daily living.
Yeah. So that's good news, bad news. Bad news that we have to contend with it. Good news in that it is difficult to transmit.
Yes. Yep. Our, New Hampshire has no cases right now, and Massachusetts has 7. Maine and Vermont have 0, so we're closely monitoring our neighbors because, you know, we're so close to the border
Right.
that people just travel
People love
back and
coming
forth.
shopping
Yep.
here.
But we are ready in case we do have, you know, a case. The public health lab up in Concord is able to test for orthopox virus, and if somebody tests positive, then the sample goes to CDC for confirmatory to make sure it is monkeypox. But we, in New Hampshire, we're set up to be able to handle if we have a case, and yeah, I think those are the highlights.
Those are the highlights. Well, that's a lot. And so I just wrapping up because we're almost out of time. June is National Fresh Fruits and Veggie Month. So I want to remind folks that we do have a farmer's market in Nashua.
It's starting, is it this weekend
I
that
believe
it's starting?
it's starting this weekend, so
Father's
it should
Day, I
be,
think.
yeah. So, you know, vegetables, can't emphasize enough, high in vitamins, minerals, fiber, low in calories and saturated fat. Commit this month to trying something new. My husband bought me some fiddleheads, so I'm going to try them. I'm going to try cooking them. I'm a little scared.
They're delicious.
Yeah, well, anything's delicious with garlic and olive oil, so they should be fine. And also a reminder, we do have a mobile clinic that's out and about at the library from 10 to 12. And we also deliver sauna syringe services also at the library. That's in the afternoon on Wednesdays. And the sign's up there, so I'm not going to read the whole thing. And then we also have our own clinic at 18 Mulberry Street. So if you are in need of immunizations, STD, HIV, HCV testing, or lead testing, please call us at 603-589-4500 and press option 2 to schedule an appointment. Flavia, thank you so much for being with us. I think we're going to get in trouble because we've gone over, but we always have so much to talk about.
We could keep going forever.
Yeah, so thank you, and wishing all of you a healthy couple of weeks here.